Developing tonight, fears over the coronavirus have left Wall Street with its worst week since 2008.
The Dow closing with a 357-point loss, and the S&P 500 lost 24 points today. This comes as the World Health Organization says the outbreak has reached the highest level of risk for the world. Organization officials say the change is meant to serve as a reality check for governments to prepare. 61 cases have been confirmed so far in the United States. Most of those are people who are aboard the Diamond Princess cruise ship in Japan. U.S. officials are continuing to calm American fears.
Are you going to see some schools shut down? Probably. May you see impacts on public transportation? Sure, but we do this. We know how to handle this.
Well, today the FDA reported the first U.S. drug shortage tied to the outbreak. More than 20 vaccines are in the works around the world.
Okay, so we wanted to get some local perspective from our own medical reporter. Dr. Mary Gillis joins us now in studio. Hi. Let's talk about the differences here between the coronavirus, what's happening in China, and what's happening here in the United States.
So I think we need to understand that while it might be sort of something we need to be concerned about on a global level, we really need to know the difference between what's happening in China versus what's happening in the United States. So China, it's gotten out of control because they haven't been as vigilant as the healthcare system in the United States. We have been ahead of the coronavirus. We have learned from past experiences, past epidemics, that we know how to get ahead of it before it gets sort of out of control. Identifying patients, quarantining them, and working on antiviral drug that is patients seem to be responding to.
And does that go with the seriousness of the actual virus? I mean, is the virus more serious in China than it is if we were to get it here? Does that make sense? Is that a silly question?
No, not at all. It's not a silly question. So what's happening, the spread is happening so rapidly in China because they're not following the same protocol that we have in the United States. It's just not the same healthcare infrastructure. So while in the United States, we're being very vigilant about where people have been, who they've been in contact with, even if we suspect that they might have coronavirus, we are on it. And, you know, for some reason, China has just not had that under control. That's why there's so much chaos.
Let's talk symptoms now, Doctor. Sure. A lot of people say it's similar to the flu. Is that the case?
Not quite.
Okay.
So there is a little bit of overlap, but we want to understand the difference between flu symptoms, and we want to understand the difference between how they differ from the coronavirus. The flu, okay, the flu is we have fatigue, we have muscle aches, we have a fever. You know, suddenly we're fine, and then we're down and out on the couch. Coronavirus affects the respiratory system. It affects our lungs. So we'll see a lot more coughing. We'll see labored breathing, shortness of breath, doing things when we might not be sort of feeling that way. It can also be accompanied by a fever. So we really need to understand the difference between what the flu is, the symptoms, and the differences between the coronavirus.
Okay, Dr. Mary Gillis, thanks so much.